surgical coding. Okay. So first, in this session, we will learn review of common otolaryngology related procedure and its associated diagnosis using important coding guidelines. Okay. Why means whenever you code any CPT code, you need to ensure the medical necessity. Correct? So in today's session, we will learn otolaryngology, common procedures as well as diagnosis. Okay. And we will learn we will use few audit case studies. Okay. And after this session, you will learn few new things. Okay. So next, otolaryngology. So what is otolaryngology? Okay. So otolaryngology is the medical specialty which is concerned about ear, nose and throat and related parts of the head and neck. Okay. So if you have the problem with ear, you need to go to otolaryngologist. If you have the problem with nose, you need to go to otolaryngologist. If you are having the problem with throat or head or neck, you need to go to otolaryngology. Okay. So usually the physician who will perform these procedures, we will call it as otolaryngologist. Okay. Next. So first we will learn about ear. So this is the anatomy of the ear. Okay. So in live session also same way we will learn everything. Okay. So here we have three sections: outer ear, middle ear and inner ear. Okay. In the live coding, these are the common things you need to remember. Temporal bone. Okay. So this is important. Okay. Concha. This is also important. Earlobe. Auricular lobule or earlobe. So this is also important. Okay. Tympanic membrane. This is very, very important. Okay. So where is tympanic membrane located, guys? Which part of the ear? Outer, middle or inner?
Inner.
Middle.
Middle ear.
Where is tympanic membrane located? Which part of the ear? Outer, middle or inner ear?
Middle ear.
Middle ear.
Tympanic membrane comes under middle ear. Okay. Parts of ear. So eustachian tube also very, very important while coding surgeries. Okay. Next, we have cochlear nerve. Here, physician will insert the cochlear device. Okay. So this is the cochlea. Okay. These are very, very important terminology you need to understand for ear. Okay. Next, we have first code cerumen impaction. So what is cerumen? So the other name for cerumen is earwax. Okay. So here impaction means blockage of the earwax. Okay. So blockage of the ear due to cerumen. So cerumen other name is earwax. The documentation contains earwax. You can code cerumen CPT codes. Okay. So because of this cerumen impaction, patient will have symptoms like ear fullness, hearing loss, itching or pain. Okay. So this is the anatomy of the, so this is the cerumen. So physician will insert the instrument and he will remove the cerumen. So 69209, removal impacted cerumen using irrigation lavage unilateral. Okay. So in 69209, physician will remove the cerumen using fluids. So basically he will inject normal saline into the ear and he will perform the irrigation. So that time we can code 69209. 69209 is for unilateral procedure. Means you can use this code for either right or left. If the patient performs like bilaterally, you need to append 50 modifier. Okay. Next 69210, removal impacted cerumen requiring instrumentation, unilateral. Okay. So this is the instrumentation. Okay. So here physician will insert this instrument and he will remove the cerumen. What is cerumen? Cerumen means ear wax. Okay. So for this procedure, your diagnosis is cerumen impaction left ear, for example. If it is right ear, you can code another code. So for if you want to use these two codes 69209 and 69210, your diagnosis must be cerumen impaction. Okay, so this is the medical necessity. If you don't code cerumen impaction as your PDX or diagnosis, you may get the denial. Okay, 929504. Binocular microscopy, unilateral or bilateral, which is the separate procedure. For example, if the patient performs microscopy of the ear, or if the patient performs examination of the ear using the microscopy, 92504. As it is a separate procedure, you can't code this procedure with any other major procedure that we will learn during our live training. Okay, so this is the cerumen impaction. Mostly in the ambulatory surgery coding you will not code, but you need to know. Mostly you will code within the ED or E&M. Okay, in ambulatory surgery coding we will not use this one. Next, foreign body removal. Okay, if the patient removes any foreign body from the ear, external auditory canal. So 69200, removal of foreign body from external auditory canal without general anesthesia, with general anesthesia. Simple. Okay, foreign body might be anything. Okay, if the patient removes the foreign body, you need to use these two codes. Okay, so if the patient creates an incision in order to remove the foreign body, you will code 69200, 69205 based on the anesthesia. If it is without anesthesia, 69200. With anesthesia, 69205. Very, very simple. Okay, so this is the external auditory canal. Correct? External, middle and inner ear. So these codes you will use for external auditory canal only, ear canal. So this is the ear canal. Okay. Next, otitis media. So what is otitis media? So otitis media is the middle ear infection basically. Mostly we will see this otitis media in children. Okay. So which is caused by bacteria or virus. So because of this bacteria or virus, patient will have fluid accumulation in the ear. Okay. So which causes severe pain, fever and hearing loss. Okay. Most of the time using the medications, this otitis media will disappear after 3 to 5 days. Okay. So if the otitis media is very, very severe, patient will insert the tubes. Okay. So here we have few codes. 69420, myringotomy including aspiration and or issuation tube inflation. Okay. So what is myringotomy here? Tummy means incision. Myringotomy means ear or eardrum. Okay. So basically during myringotomy, as we have discussed, because of otitis media, patient will have fluid accumulation. Okay. So during myringotomy, patient will create an incision and he will drain the fluid from the ear or from the eardrum. Okay. So that time you will use these two codes. 69420, myringotomy including aspiration or issuation tube inflation. Okay. So this is without anesthesia. Same procedure if the patient performs using the general anesthesia. 69421. Okay. Next we have 69433 and 69436. Now we need to understand tympanostomy. Okay. So as we have discussed previously, if the fluid accumulation is very, very severe or chronic, so in order to drain that fluid because of otitis media, patient will insert the ventilating tube. So insertion of ventilating tube, we will call it as tympanostomy. So 69433. So here, if the documentation contains local or topical anesthesia, we will quote 69433. Okay. If the documentation contains tympanostomy, with insertion of ventilating tube with general anesthesia, 69436. Okay. So these are very simple. Just based on the anesthesia, you need to code. So what do you need to check? Whether it is local anesthesia or topical anesthesia. Okay. Topical means application of anesthesia on the tympani or ear. Okay. 69424. Ventilating tube removal requiring general anesthesia. Okay. So 69436 is insertion of ventilating tube, general anesthesia. 69424 is ventilating tube removal. After removal of the fluid buildup, patient will remove the ventilating tubes. That time you will use 69424. Okay. Next we have cholesteatoma. Okay. So basically cholesteatoma. So this is like non-cancerous skin growth or cyst. Most of the time which will be developed in the middle ear. So this is the normal ear. Okay. So this is the perforated eardrum. So perforation means hole. So this is the hole here. This is the cholesteatoma. Okay. So basically cholesteatoma is the cyst on the middle ear. Okay. So because of this cholesteatoma, patient will have abnormal collection of skin cells. So that time you will use this one. So here your diagnosis will be S7121 cholesteatoma of mastoid right ear. So based on your laterality, you need to code. So this code is for right ear. Mastoidectomy complete 69502. So mastoidectomy. Okay. So basically using the mastoidectomy procedure, patient will remove the mastoid cells or mastoid bone, which is the bone present along with the ear or backside of the ear. Okay. Most of the time patient will perform this mastoidectomy for cholesteatoma. Okay. So 69502 mastoidectomy complete. So patient will remove complete mastoid bone. Okay. So using the incision, patient will get the access. 69511 mastoidectomy radical. Okay. So this is complete. Only mastoid bone removal. So mastoidectomy radical. So here patient will get the access through tympanomeatal flap. Okay. So along with mastoid bone removal in 69511, patient will remove middle ear mucosa also. Okay. And also patient will perform external meatoplasty or external ear canal repair. Plasty means repair here. So that time you will use 69511. 69220. Debridement, mastoidectomy, cavity simple. Okay. 69502 is complete excision of the mastoid bone. 69220 is debridement. Okay. Of the mastoidectomy cavity. Simple. So this is after performing the mastoidectomy. If the patient performs debridement, you need to use this code 69220. So this is original mastoidectomy. This is debridement after the mastoidectomy, usually after 3 to 6 months. Okay. Next we have, so we'll see one scenario here. Mrs. Beer is seen today for evaluation of her right ear. So she reports occasionally otalgia in her right ear and mild discomfort in both ears. No otorrhea or any other concerns. Dr. Voto uses a handheld operating speculum otoscope to inspect the both ear canals. He finds that her right ear canal is 70% impacted with wet sticky cerumen. So initially we learned cerumen impaction, correct? So this is the keyword, impacted with sticky cerumen. It is cleaned utilizing cerumen loop. So left ear canal has minimum cerumen present. Both tympanic membranes were inspected and looked great. There were no complications. Patient tolerated the procedure well. Okay. So basically here patient has performed the removal of the impacted cerumen on the right side. See here, this is the right side. Okay. So assessment plan, impacted cerumen in the right ear canal, cleaned with resolution of her discomfort. Use a drop of mineral oil twice daily for home management, follow up as needed. Okay. So what is the code here, guys? Who wants to try? Who wants to try the correct code here? So your clue will be based on the laterality. Documentation, we need to code this one. 69210 RT. Why means patient has removed the cerumen from the right ear. Correct? So we need to code this one. So here also patient is telling right ear canal. Okay. So here your code will be B. 69210 RT and your diagnosis will be H6121. So this we will not code. Why means patient did not use any microscopy during the procedure. So C is wrong. D is also wrong. Why means this is not an E&M service. This is also wrong. And A is also wrong. Why means patient has performed this procedure on the left side. Sorry, right side, not on the left side. So your answer is 69210 R3. Okay. So that is the thing you need to remember. So